The federal government of Nigeria, in keeping up with its goal of reducing the rising level of poverty and economic vulnerability in the country, established the National Cash Transfer Office through the National Safety Nets Project, NESSP, under the supervision of the Federal Ministry of Humanitarian Affairs, Disaster Management and Social Development. The NCTO is put in place to provide cash transfers to poor and vulnerable households mined from the National Social Register under an expanded National Social Safety Net system, as well as build the capacity of the beneficiaries with the sole aim of achieving the following outcomes: improved household consumption, increased utilization of health and nutrition services, improved school enrollment, attendance and completion, improved environmental sanitation and management, beneficiaries engaged in sustainable livelihood, assets and financial acquisition. The program commenced in 2016 and to date has enrolled almost 2 million beneficiary households with over 9 million household individuals in the National Beneficiary Register (NBR). The beneficiaries receive a bi-monthly cash transfer of 10,000 naira to help increase household consumption levels and develop their human capital. The program is being implemented across the 36 states and the Federal Capital Territory. The Honorable Minister of the Federal Ministry of Humanitarian Affairs, Disaster Management and Social Development, Sadiya Umar Farouq, has given the NCTO the needed support to properly implement the cash transfer program in order to achieve the President's vision of lifting 100 million Nigerians out of poverty in the next 10 years. She speaks in this exclusive interview.
The beneficiaries of the Household Uplifting Program, otherwise known as the Conditional Cash Transfer, are the poorest of the poor and the most vulnerable households in Nigeria.
How are beneficiaries selected?
Beneficiaries are selected using community-based targeting process, which allows community members themselves to identify those that are poor and vulnerable amongst them, and a proxy means test is also being applied to rank these beneficiaries based on poverty level into deciles 1 to 10 in the National Social Register. And the lowest deciles represent the poorest, hence households that fall in deciles 1 to 6 are selected to benefit from the cash transfer program.
How do you ensure equitable distribution of beneficiaries across states?
The number of beneficiaries per state is determined by the state's quota, which is established based on population and poverty headcount. And the 2 million benefiting households across the country are equitably proportioned based on estimated population in poverty across the 36 states of the Federation and the Federal Capital. Specifically, in alignment with state population and poverty headcount of National Living Standards Survey, NLSS, statistics of 2018 and 2019. In percentage, Northwest represents 40% of those that are considered to be very poor. The Northeast has 20%, North Central 15%, Southwest 4%, Southeast 13%, and South-South 7% of the estimated population in poverty.
How many beneficiaries do you currently have in your database?
The program has successfully enrolled close to 2 million households in the National Register who receive this bi-monthly cash transfer across 48,789 communities. 6,260 67 wards and then 609 local government areas out of the 774 local government areas that we have in the country. And this covers 36 states, all the 36 states, and the Federal Capital Territory.
How is payment being done to beneficiaries of the program?
The delivery system for the cash transfer program has evolved slowly from table cash payment to digital payment, where beneficiaries receive stipends directly into their Nubank accounts opened by the payment service providers. And these providers are licensed by the Central Bank of Nigeria. So I can say we have achieved a lot in this respect, and with this development, the system is put in place to enhance accountability, reconcilability, secured payment, and transparency of the cash transfer. It is an initiative that we can authoritatively say that has achieved financial inclusion for beneficiaries in rural low infrastructure areas.
Are there success stories on the program?
At the commencement of the program, we had an initial target of 1 million households to be enrolled on the program, but we have gone past that target. The program has now enrolled almost 2 million households across the 36 states and the FCT. Institutionally, the project has well-established structures in the states and local governments for outreach and sustained engagements with beneficiaries. Through these structures, the state beneficiary registers are built, which cumulatively forms the National Beneficiary Register. This has facilitated financial inclusion, as mentioned earlier, of 2 million beneficiary households. Robust payment systems, fully digitized to the last mile, and robust grievance redress mechanisms also, with a call sorting center. And what is most important about our success is the impact of the program on the lives of this very special category of people across the country. And seeing lives changing is more rewarding and fulfilling. And beneficiary households who had nothing before, they started benefiting from this program, established their sustainable means of livelihood from the stipends they receive, which is truly very satisfying.
I born 10 children. I was not able to send them to school. So even to eat, we were not able to eat. Since government coming, with the little money they had to make, I've been able to sell this market than before. Because before I was just selling them little. So now I've seen improvement in my market. So I thank government.
Ụmụaka wee bidokwali juba afọ. Mweje na-ego akpụ n'ana. Ngo akpụ erota nya ntu a. Abanye nya 4 days. Ayo nya supply ya ndị na-asụ ebinye ndị hotel. Anyị wee na-erijuzi afọ. O wee dịla anyị mma. Anyị na-eriju afọ. Nke ọzọ, mụnwa jikwa ego ma na-arụ ọrụ ugbo.
Na samu ci gaba sosai don a lokacin nan ma da yara ba makaranta, amma wannan tallafin gwamnatin ne yasa har aka samu damar sa su a makaranta. Suna yin makaranta yanzu sosai, ana biya musu kuma kam a cikin wannan tallafin da muke samu. Bacin haka har na samu kuma na sai wannan sana'a da nake yi.
Tun da gwamnati ya taimake ni yana biya mini kudin nan a wata. Shine mun samu kudi wannan muna yi sana'a da shi muna sai kaya.
Tẹ́lẹ̀tẹ́lẹ̀ oúnjẹ kan náà ni tá bá ti rí máléèjì jẹ láàárọ̀, a máa mú mi sí yòókù títí di alẹ́ ká tó wá nǹkan tá jẹ. Ṣùgbọ́n ní ìsìn tó di yí pé wọ́n ń ṣàánú wa, wọ́n ń bùn wá lówó yìí, àyípadà dáadáa ti bá wa.
Allah ya ji kukana. Yadda ni ma na samu, ina son kowa ma shi ma wanda ke cikin hali irin nawa. Allah Ubangiji ya sa wannan tallafin shi ma taimaka masa. Shi ma ya huta irin nawa.
is there a channel in place for aggrieved citizens to make complaints in the implementation of the program?
There's a robust grievance redress mechanism system put in place to facilitate the reporting of these grievances from both beneficiaries and also non-beneficiaries or beneficiaries in waiting. And these complaints are taken seriously and addressed to improve our service delivery.
What is the future of the National Cash Transfer Program?
Let's look at Bolsa Familiar Conditional Cash Transfer Program, which focused on health and education, that is being implemented by the government of Brazil since 2003. And the Indonesia Cash Transfer also program, which started in 2007. And this program is aimed at providing the quality of human capital by providing cash transfers to enable easy access to health and education services. These countries are third world countries who have made significant progress in pulling their citizens out of poverty. They are where they are today based on the fact that they made deliberate efforts towards institutionalizing the program. Nigeria has styled the same line because we have started the process. We have taken our bill to the Federal Executive Council, and that bill was approved by the Federal Executive Council. It was taken to Justice. Justice has now taken it to the National Assembly, and we are in the process of public hearing. So we are working very seriously to see that that is being achieved before the end of this administration, because as you know, this program is a major tool for poverty reduction in the country. It's a major tool for human capital development. It's a major tool for addressing so many issues, even the education that we're talking about, health sector, youth empowerment, women empowerment is all inclusive in these programs that we have under the conditional cash transfer. Is one of such programs, and I hope that I am very optimistic that the 9th Assembly is going to pass this bill, and Mr. President naturally is going to give assent to it in the shortest possible time. And with that, we know that we have this administration under the leadership of His Excellency President Muhammad Buhari is going to leave a lasting legacy.
In closing, the program is scaling up to reach out to more people using existing delivery systems to provide economic shock response cash transfer to poor and vulnerable households drawn from the National Social Register and Rapid Response Register. The implementation of the cash transfer program is fast ensuring the actualization of Mr. President's vision of lifting 100 million Nigerians out of poverty. It is anticipated that NCTO will institutionalize a sustainable system for providing social assistance to the poor in the long run and a national platform for the delivery of humanitarian interventions in Nigeria.